Well, welcome to our event this afternoon. For those of you who have joined, I'm Deborah Dobbs. I'm the chair of the Social Research Policy and Practice section of GSA. And today we have an SRPP GSA Fellows live event where we will have two distinguished fellows that Sara Bybee will be interviewing. And just a few housekeeping rules before we start. Our program is being recorded today and will be archived on the GSA website. There will be questions and answer session at the end of the program, so feel free to submit questions using the Q&A feature at any time. And the Q&A feature is at the bottom where you have the icons for the different functions of Zoom. The chat will be open throughout the whole meeting for everyone to use, but please submit questions through the Q&A. So you can chat either with everyone if you want to send something, or if you see someone on the attendees list that you want to reach out to and say hi, you can use the chat function. But Q&A is just for questions for the attendee, for our moderators of the session. So I'll get right into this, into our program. I want to first introduce Dr. Sara Bybee, and she will be our facilitator of the program today. Sara obtained her PhD in nursing from the University of Utah as a postdoctoral scholar through the Utah Center for Translational Science and Implementation TL1 training program. Dr. Bybee works on projects related to social needs screening and resource referrals among historically marginalized and underserved populations. She's currently examining the physical and mental health outcomes of state eviction laws. As a licensed clinical social worker, Dr. Bybee aims to conduct research that will ultimately improve the health and well-being of historically and intentionally excluded populations. Next, I will introduce our two fellows. We have a more senior fellow. I don't want to say senior in terms of age, but it could be both age and years of tenure. We have Dr. Robert Applebaum, who's a professor of gerontology in the Department of Sociology and Gerontology and director of the Ohio Long-Term Care Project at Scripps Gerontology Center, Miami University, Oxford, Ohio. He holds degrees from Ohio State, a BA, and then the Ohio State University MSW, and the University of Wisconsin-Madison is where he received his PhD. He has been involved in the development and evaluation of long-term care programs across the United States for more than 35 years. He's worked with more than 25 states on innovations in long-term care services and supports, and the delivery and completed a series of state and national studies on long-term services and supports. Dr. Applebaum has been a frequent speaker at national and state conferences on long-term care. He's authored more than 100 articles and monographs and 4 books on long-term care, and he has testified at state and federal legislative hearings more than 20 times. He's been the principal investigator on more than 50 studies and received more than 10 million in external grants. Dr. Applebaum has been an active member of GSA since 1979, an old timer, a long timer. And in addition to being a fellow of GSA, he served in the society in a number of ways, chairing the Social Research Policy and Practice section, chairing the Research Education and Practice Committee, serving as a member of the Public Policy Committee, and serving on the Strategic Planning Committee. He's been a member of the Board of Directors for American Society on Aging and has chaired the editorial board for the Society's journal Generations. Thank you, Bob, for joining us today on our program. Secondly, we have Karon Phillips, and she is a newer fellow, but no less involved in and active in gerontology. So Dr. Karon Phillips is the Policy Development Manager at Trust for America's Health, where she works with the policy development team on the Age-Friendly Public Health Systems Initiative. Dr. Phillips has been engaged in the field of aging for over 15 years with expertise in health equity and community engagement. Prior to joining TFAH, she served as the program manager at US Aging, which was formerly the National Association of Area Agencies on Aging. In this role, she developed content and resources for Engage, the National Resource Center for Engaging Older Adults. Prior to her work at N4A, she served as a scientific Review Officer Contractor for the Center for Scientific Review at the NIH. Excellent. In this position, she supported the scientific review of research grant applications made to NIH. She also has experience leading the implementation of programs and services focused on health promotion, including chronic disease self-management and falls prevention, and developing new partnerships to provide community-based services to older adults. Dr. Phillips received her undergraduate degree in English and Women's Studies from Cornell and earned a Master's of Public Health degree and PhD in our own School of Aging Studies and from University of South Florida. Dr. Phillips has been engaged with GSA since the fall of 2004 as a first semester graduate student. She became a GSA Fellow as recently as 2022. Sure. So over the years, she has served as the Secretary for ESPO, the Junior and Senior SRPP representative to ESPO, and the liaison to the Minority Issues and Gerontology Advisory Panel. She is currently serving as a member of the Board of Directors for GSA. At this moment, I'll turn it over to Sara, and she can facilitate some questions we have. And I'm going to turn off my camera and mic.
Thanks so much, Deborah, and thank you to Karon and Bob for being here today. It sounds like you guys both bring a wealth of experience in many different interesting areas, so hopefully we'll get to touch on those today. I wanted to start out, and I'm just going in the order on my screen, with asking you both in 5 minutes or less to tell us what initially drew you to gerontology. And Dr. Phillips, I'd like to start with you.
Well, thank you so much. That's always a fun story to tell. It honestly started because of my grandparents. I know that sounds generally how most people's stories are. Oh, I engaged with my grandparents and I love working with them. But it started with my grandfather being taken by my mother to a facility. It was part of Emory University. It was called Wesley Woods. And he was receiving services there. And my mom saw a flyer for an experience called Volunteens. And it basically meant that you were going to sign up to do, I think it was about 6 weeks of volunteer experience somewhere on this campus. And the entire campus, the section of the Emory, if you will, was focused on older adults. So they had a retirement home and assisted living, a nursing home, a day program, hospice care. Everything was on this small little sub-campus at Emory University. And I was there with about maybe 7 or 8 other teens. I was 15 at the time, and I had a blast. I had an absolute wonderful, extremely amazing time. And I knew then, this is my population. I come from a long line of educators from the school system on both sides of my family. And I remember sharing, hey, I want to work with older adults. And they're thinking, oh, okay, so you want to be a nursing home administrator? And I said, that's not it. But I really enjoyed that, that experience. And I remember my family trying to figure out, well, what else can we expose her to foster this interest? But it really started there, and it just having that and having the influence of both my mother's parents and my father's mother in my life. That was the beginning of the budding gerontologist, if you will.
Thank you. That's really interesting to hear. I never heard of a program like that before. I'd like to ask you the same question, Dr. Applebaum.
Sure. So, one of the things I always tell my students is that there are all these forks in the road of life, and how you end up someplace is somewhat planful, but somewhat quite random. So in my case, as a MSW student, I was working at a community center, and I got signed to the Golden Ager group, which was aptly named, in those days. Those are the names we like to use. And I just got fascinated working with folks who were participants in that. And I really was drawn to their incredible desire to remain independent, and it was just a fierce message that they all communicated to me. And so then when I went on to my PhD program at the University of Wisconsin, I had just the luck of being assigned to work on something called the Wisconsin Community Care Organization, which was one of the early evaluations of care management and expanded long-term services and supports in the community. And again, that desire for independence and to be in control of your life was reinforced in that experience. And so that sort of really brought me to focusing on aging and what folks wanted as they experienced disability. And then as I graduated, I got hired to be able to work with Mathematica on the evaluation of the National Challenge Demonstration, which was a 10-state project that tried to examine the expansion of home and community-based services. And by that point, I kind of really was pretty much into that world and have never left 40 years later.
Great. Thank you both for sharing. It's interesting to hear about the beginnings of your interest with gerontology as we focus now on kind of the next step. So I'd like to ask you both what you're focusing on now, what you're working on, whether that's research or clinical practice or education. You could tell us a little bit about your primary focuses right now. Again, I'll start with Dr. Phillips.
Sure. So I wear a couple of hats, but my 9 to 5-ish, if you will, I'm a policy development manager for Trust for America's Health. It's the best job I didn't know I wanted. And I am the one of the leads on our age-friendly public health systems initiative. The short of the long is that our goal is to make sure that healthy aging is a core priority with all departments of health throughout the country. But that gives us the opportunity to do some really exciting things and engage in some really exciting organizations. So for example, we are focusing on rural health. That's one of our areas of focus in our upcoming phase 3 of our funding. We're funded through the John A. Hartford Foundation, and we just recently learned that we're going to be funded for 3 more years to continue this work. And so rural health has come up as an important, as Kathy Greenlee, former Assistant Secretary on Aging, says, it's not a new topic. It's something we need to address, but it's we're focusing on how do we promote healthy aging in rural communities. We're also very committed to, again, recognizing the work that's being done at the local level in departments of health and hoping to recognize and acknowledge it, whether it be recognizing the unique and innovative partnerships they're engaging in with the aging sector, such as agencies on aging, but also other entities as well in the community, whether it be academic partnerships or if they are expanding their work into age-friendly universities or age-friendly health systems as well. We also focus on the larger age-friendly ecosystem, so universities and age-friendly communities, et cetera. So we're also very interested in seeing how those connect and work together. And that's a short synopsis. I don't want to take up too much time. I'm happy to always talk more about my full-time job, but I also am an adjunct. I actually did not ever think I would be an adjunct, but I have been doing it for about 11 years now. Actually, no, 12 years, sorry. And it's something I thoroughly enjoy. It's kind of my core belief that I need to make sure that our future generations of upcoming gerontologists needs to be supported and encouraged and mentored, but given real world context along the way. So I'm deeply committed also to teaching and bringing that real world context into the classroom and supporting future generations and encouraging others to become interested in the field and help us advance the field further. Yeah.
So you're continuing on your family's history of being educators.
Yes, they said, "Hi, but you ended up back in education." I did get tickled by that. I said I did end up in education, so I'm still allowed at the family reunions. I'm in education.
That's great. And Dr. Applebaum, what are you focusing on right now?
So there's 2 areas that I spend most of my time. The first one is that it involves really trying to rethink about how we provide long-term services and supports in this country. If you look at our social policies and programs and funding, we pretty much are driven by the Medicaid program. So all of the HCBS programs, all of the nursing home funding, it's really driven by Medicaid. And the problem that I see is that 90% of older people aren't on Medicaid. So it's a really small proportion of people that are really on Medicaid. And so we have a system that will come in and do something once the wheels fall off, but before the wheels fall off, we pretty much ignore you. And I think that's backwards. I think it doesn't provide people with good quality care and quality of life. And it's really expensive, because if you could do some things along the way, you could prevent a lot of the things that are happening. And so I think I'm really focusing heavily on social care and the kinds of things that will help support people to stay in the community before they're sort of at the point where they really need ongoing long-term services and supports. And so we've been doing work. Interestingly, there are 15 states around the US that have property tax levies or some other kinds of levies that fund in-home services at the local level. And while it may not be the ideal solution, we are not likely to have a federal policy to address these issues. And so local communities across the nation are doing this. We just completed some work funded by the RRF Foundation on Aging, and found that in those 15 states, those local programs were raising more than $400 million a year. And if you put that in context of the Older Americans Act, that's a pretty good chunk of money that those states are raising. So really interested in trying to understand how those expanded support services can help people remain in the community, can reduce low care people in nursing homes, and some of those kinds of things. So that's something that I really have been spending a lot of time on lately. And then just in general, I continue to be a program evaluator, and we're evaluating several programs across the state and the nation. And I started out as a social worker, and I like to say that I wasn't really that good of a social worker, because I always would say, I wonder if this works or not. And so I think those traits were better to being evaluated than they were to be a practitioner, because at the end of the day, a practitioner needs to believe in what they're doing. And I was always like, I don't know about that. So I continue to work on evaluation and making sure that programs work from an evaluation perspective. And those are the two areas where I'm spending all of my time.
Great, thank you. It sounds like you both are continuing to do some really interesting work. I have a somewhat different questions for each of you for the next round. For Karon, I'm wondering if you could tell us a little bit about what your goals are for the future.
I kind of read that as what I want to be when I grow up. So I think it's two-part, maybe even multi-part, and it might grow legs beyond that. But I know I already alluded to this, but one of my core missions is to continue empowering and bringing in more people interested in the field of gerontology. I reflect on a lot of my trajectory and the programs and the training that I received. Unfortunately, a lot of those programs do not exist. I did some amazing programs. One of them started with Dr. Keith Whitfield at Penn State, and it was a summer program. And at that time, I was very new to trying to understand what exactly the field of gerontology looked like, but it was a great summer program that we did, and I got to meet some of my colleagues and friends that I know to this day from that summer experience, focused specifically on gerontology. That program doesn't exist, but there were others that I did, and again, it was those connections and engaging with now not only colleagues or friends at this point that really were pinnacle in helping me get to where I am. So in lieu of having programs, I'm hoping to be a resource to anyone that is remotely interested in working with older adults, not just people that are in my classroom or students are in my classroom, but anybody for that matter. Of course, I enjoy talking about aging because that has been my entire career, but also helping people think more about healthy aging. I know one of the key things that I am deeply committed to is the reframing aging mission and changing how we talk about older adults. And I'm still in the battle with some of my students about, please don't use the word elderly. We don't say that anymore. But just getting them to understand what older adults look like, and that older adults are not a monolith and they don't all have the same experience, but exposing them to different types of opportunities within the aging sector. So talking about different career trajectories and exposing them to different opportunities. So for example, talking about my experience working in affordable housing, it was great, but I didn't know that was gonna be part of my career trajectory, but it was a really, really great experience. So that's one part. The other part is I'm excited about what we're doing in our next phase of our project that call it TFAH, Trust for America's Health. We are focused on working with public health institutes and helping them, equipping them with tools to support their states and departments of health to, again, promote and further this agenda of making healthy aging a priority. It's exciting to me because it involves not only working with a different type of entity, but again, focusing on developing training modules. So in some ways, bringing in my experience with developing classes and coursework into my other role, and again, coming up with innovative ways to engage with these public health institutes. So I'm looking forward to that. But I'm also, again, deeply committed to partnerships, and also not only highlighting partnerships that are occurring. I think the pandemic was a very unique experience. It has been a unique experience, I should say, in showing how we can levy resources and achieve a greater goal. I'm a firm believer and very big advocate of innovative partnerships. And so not only am I always interested in new partnerships, but encouraging other organizations to partner with different entities to help older adults as well. So somewhere in there, my goal would be to continue to be that voice, that champion for partnership innovation, and continuing to make sure that we're making sure that we not only do we focus on healthy aging, but we focus on life course perspectives as well, in all settings, because I think we have learned through COVID that we definitely need to think beyond just the immediate and think, again, life course.
Great, thank you. Well, maybe after this, you'll have, we have 29 participants. You'll have 29 email requests for meetings with you to discuss careers in gerontology. A little bit different question for Dr. Applebaum. We're just wondering if you could tell us a little bit about what you think is the greatest impact that you've made to the field.
Wow. I don't feel like as individuals, I necessarily have a great impact. I think I've been part of a group of folks who have been talking about how and why the long-term services system needed to be changed. And I think because of the efforts of many people, we really have really changed that system. The first research project I ever worked on at the University of Wisconsin as a graduate student, we looked at disability levels of nursing home residents in Wisconsin, and 40% of the people that were living in Wisconsin nursing homes in this study that we did had zero activity of daily limitations. So it was like, okay, it's cold in Wisconsin and you become a widow and you go live in the nursing home, and people would live in nursing homes for 10, 15, 20 years. And as people began to think about alternatives, there was a lot of pushback to say, oh no, gosh, people couldn't possibly live in their own homes or live in the community with disability. And I think from the early projects, including the Wisconsin Community Care Organization, and then of course in channeling, there was lots and lots of evidence that were made to show that, yeah, you can live in the community with lots of disability and still be able to have good quality care and good quality of life. And so I think there's been a lot of people who I've worked with together over the years to be able to do that. But I think, in a state like Ohio, where we had a very strong nursing home industry and a lot of people who were putting up barriers about being able to expand home and community-based services. And we've been involved in this study over the last 30 years, and where we track about the balance of the system. And 30 years ago, when we started our study, 90% of Medicaid folks who were getting long-term services were getting those services in a nursing home, and today the split is about 60-40 in favor of home care. So even a state like Ohio, Ohio has changed dramatically how it delivers long-term services. Some states have changed even more, but I think there has been an incredible change in how we do that. And that's certainly been a big part of my career and a big part of the work that we've done. But it certainly is something that's involved a ton of people, both in the state and across the country.
Thank you. And I also really like that reminder about team science and the importance of working as a team to have a greater impact. So I appreciate that. I wanted to kind of switch gears and talk a little bit about your experiences as fellows. Can you tell me a little bit about how your experience as a GSA fellow has been, maybe how it's impacted your professional role? We'll start with Dr. Phillips again.
Well, it's interesting. As a new fellow, I think it's a situation of I feel as if I am able to give back even more to the society, if that makes any sense. So I generally don't say no to anything when I'm asked to participate or contribute to, especially if it's around, again, mentoring, but I feel like I get to be of more service, given that I've reached this point. And it's exciting to me to be able to engage with more opportunities to help facilitate or be a part of different discussions at the meeting and outside the meeting. Again, I think I consider it a privilege to be at this point. I remember sitting on the other side of this, and you would see, oh, come chat with the fellows, or come, fellow so-and-so is featured here, and you'd say, okay, I gotta go, because it's a fellow that I've always admired, and I want to hear what they have to say, or how they navigate this part of their career, or whatever the topic was. But I consider it a privilege to that I get to be a part of different opportunities that help me contribute back to society even further. That has been I have two academic homes. Public health is my other academic home, but GSA has been a major part of my development. So I think it's important that I, again, return on the investment.
Thank you. And Dr. Applebaum, how about you?
That's an interesting question. For me, I would say I was sort of a reluctant fellow. I'm kind of one of these people that, joining clubs, fraternities, whatever, just never really felt all that comfortable to me. And so, I was sort of in GSA for a long time before I became a fellow. I'd already been the section chair of SRPP, and I wasn't a fellow. And I think at some point, one of the section chairs, I think it was Kathy Sykes, who said, you really should do this, and here's why. And I think in retrospect, I think that she was right, that I do think we have a responsibility to try and be mentors and provide mentorship to junior folks. And I think that I probably, in retrospect, wish I had done it a little bit sooner to have more opportunities to do that. And so I think that, to me, GSA is my primary professional home. And so the opportunity to be able to work with folks across the spectrum has really been a great part of my career. And I think that probably I wished I had maybe become a fellow a little bit sooner, but I was definitely fellow resistant for the first part of my career.
I'd say Bob, Kathy's one of my favorite people on the planet, so I can imagine saying no to Kathy was probably tough too.
So this kind of stems right from something that Dr. Applebaum was mentioning, the desire to maybe have been a mentor a little bit earlier on. So I'm going to kind of switch that around. So that's advice maybe you wish you had received. What's some advice that you think would be important for other members or early career scholars as they begin their careers or aspire to become a GSA fellow?
Is that one for me, Sarah?
You can start this time.
Okay. So, as I mentioned, GSA has been my major professional home, and I do have a lot of relationships that are rooted in GSA. And so some of my national research projects, some of my, certainly some of my publications and presentations are very much linked to the people that I have met. And, we do certainly have our colleagues at our home universities, for those of us that are in university settings or in organizations, and we do a lot of day-to-day stuff with them. But it's also the case that sometimes there are people that are really spot on to the kind of work that you're doing that don't live at your university. And so a place like GSA has provided me with the opportunity to be able to meet those folks and to think differently about the world than just in my little sort of home place. And so I'm really very excited to be able to have the opportunity to work with people all over the country. And I think that's one of the things that has been for me just a phenomenal part of GSA. And so I think that my encouragement would be that take advantage of those options, go and be able to go to sessions where and don't hesitate to walk up to people afterwards and talk about and say, hey, I'm interested in this. What are the opportunities? And I've had a number of people over the years who have sort of come up and have ended up generating new projects or generating publications. And so there are people on this call that I was able to meet and work with at GSA. So I think don't hesitate to become involved would be my major advice.
That's great. Thank you. And Karan, how about you? Any advice for earlier career scholars or people who would like to become GSA Fellows?
I will just echo Bob's comments. My APHA is my other home, and it is much larger. And making connections there is a lot more challenging and takes a lot more legwork. But I call GSA, whenever I go to GSA, I call it homecoming for me, because I get to see not only people that I've known since starting my PhD program, but people that have become my dear friends. And I think, to Bob's point, don't be afraid to talk to people after a session. You never know what that may lead to. It's very, very important just to keep in touch, even if it's like, hey, do you have 5 seconds to grab coffee or just chat? But also, I also would encourage you to just get involved. I started in ESPO, and that gave me an opportunity to connect with people at my level as well. We have to keep in mind, we all do evolve. And so we all grow into different positions. So now I have colleagues and friends that are department chairs and program directors and all leading great things. They're a phone call away. So it's important to also keep those people in your network. They're your friends, but also you never know where that could lead. So your colleagues, your friends and your colleagues are the ones that know you best. So there's, if you're looking for a job, you want to start with your network first, and part of building that network is having people get to know you. I'm in a service sorority, so part of the message is that you get to know people through your work. It's not just an opportunist thing, but you're actually putting in effort, you're actually supporting the society, you're actually pouring back into the organization. But then you also then get to see how that person works, and then say, I've worked with them, not necessarily in a 9-to-5 capacity, but I've worked with them on putting together a symposium. I worked with them when we were hosting this panel. So you get to see how they operate. And then again, you never know where careers will lead you. And next thing you know, you're collaborating on papers, you are co-presenting at conferences, and it doesn't take as much coordination. It's, oh, I know exactly who we need to call. We'll call this person because we know what they're capable of. We know what they're doing. We've worked with them before. DC is very much a who do you know town, if you will, and that is a big part of that. I work with them. I know them. We'll call them. I know them. I've known them for years. So I echo again Bob's point, but also again make sure you, and on any level, try to get involved in any role that you can in the society.
Oh, and Sara, I also forgot to mention my advice is to make sure you make it to the All Ohio party, because it is the best party at GSA.
Are we all invited now?
Absolutely.
I know. Is that an open invite? Okay.
Open invitation.
I'm just going to say I'm with Bob. And
Well, that's great. I really appreciate that advice. Forming relationships, maintaining them, maintaining your network, giving back to GSA, attending the Ohio party. Sounds good. I've got some people echoing that in the chat. I just have one more question for you guys before we kind of open it up to the audience for any questions that they might have. And this question is really about any ups and downs in your career. So I'm wondering if you can tell us about a time period or an event that was more of like a mountaintop experience, you know, a really big highlight of your career thus far, and maybe a time that was a challenge and how you managed that challenge. Whoever wants to start can go first.
Go ahead. Go ahead, Karon. Yeah.
I'm going to start with the mountaintop, and I know it's going to sound like I'm bragging, but my career mountaintop has been my current role. And I say that not because they're my current employer, but because all of the experiences that I've had prior to this role made sense when I entered this role. I've utilized all the skills that I've obtained prior to this position in this one role. This role actually lets me get to be 100% me. And I get to take on different challenges, and I get to utilize what I know and express myself in a way that's productive. So ideas that come, I'm able to talk them out, and they're supported. So I will say it's been rewarding, but it's also been great for just me as a gerontologist, being able to bring in my public health background, but all these other experiences that I've had in housing and working at the NIH and working, I don't know if I shared this, but Bob, I worked at an evaluation firm for a little over a year. All of that experience actually came and is utilized in my current role. So that's been an exciting experience for me, because I can take that and I can utilize it all, and then I can expand from there. So that's been my aha moment of it all makes sense now. So it just was like a light bulb went off. I will share, someone gave me advice when I worked on the Hill, and I will publicly share this because it's not a secret. I did not last long on the Hill. I was, that was part of my, I was in health, you're never not, but I was a health and aging policy fellow in 2011, 2012. And I started my placement on the Hill, and I did not last long. It was not, I was not cut out for the Hill environment. It was a little too rough for me. Some people make it, some people love it. It was not for me, but I remember meeting someone there who told me, you learn something from every experience. And I remember thinking, okay, whatever, this still was not that great for me. And I remember hearing his voice every time I entered into a situation or I went somewhere and had an experience that was maybe not the desired outcome, or maybe not exactly what I thought it would be. And remember thinking, but I did learn this, and I did learn that, and I'm able to apply that to this setting and that setting. So all those skills and tools and experiences have helped me navigate a lot of scenarios. I'll give a very brief example. I started a position once that was advertised as one thing, and in practice, it was not what was presented to me. And it ended up being a lot more related to communications and marketing. That is not my background, not my interest, not even really something that I ever saw myself doing. But I was able to, at least in that experience, say, well, what can I take from this? And I did learn quite a bit about communications and marketing. And it actually comes full circle. I ended up using those tools in my current role. Again, not somewhere I had to stay long term, but I did gain something from that experience, and I did learn something there that I still am able to say, hey, I can do this, and I can take that information and that skill set and apply it to my current setting. So positive and wonderful, or not, we'll put it nicely, not exactly what you want to be. You still learn things in all roles, whether it be skills, soft skills, hard, the technical training, et cetera, content area, but you learn something in every experience. So I'll share that.
That's great. I love how you reframed that. Maybe you're a social worker at heart.
My mother is a social worker.
There you go. It's in the blood. Bob?
I would say some fun things for me have been the opportunity to be part of some kind of big media activities. And so a couple of years ago, as I was able to be on Science Friday to talk about nursing home reform, and that was pretty cool because the kind of science I do doesn't usually end up on Science Friday, but that was kind of fun, and other kind of NPR stories and those kinds of things. So those are fun things. I would say probably the other big up has been, when we've been able to have data that can influence decision makers. And a lot of the times that's for the low, is that our reports don't jive with the politics of the moment, and they end up in the round file trash can. But every once in a while, we do get to have an impact on the decision making that's happening, and we certainly have done that. And then one year, the Pew Foundation and MacArthur Foundation did a review of state research that influenced state policy. And for Ohio, the one thing that they had was our research on balancing the long-term services system. So every once in a while, you get sort of things that can make a difference. On the low side, I sort of mentioned the reports ending up in the round file trash can, and that has happened many times, certainly over the course of my career. The other thing was just sort of on the media side. One of my first media appearances, I was on a local television show, and they had a moderator and 3 panelists, and the camera was on the moderator, and the 3 panelists were off to the side, and I was spinning around in my chair, not paying attention, and I didn't know that the camera was on me. And it aired at the lively hour of Sunday morning at 8 o'clock, but my son at the time was like 10 years old, and I said, "Hey, let's go watch Dad on TV." And I watched for like the first minute as I was spinning around in my chair, and my son thought it was the funniest thing he'd ever seen, but not a high point on media relations. So there you have it. So.
Well, thanks for your honesty in that one. Karon and Bob, thank you so much for taking the time to share a little bit about your careers and aspirations with us. I'm going to open it up to the question and answer now. So the first question I'd like to ask you, and either one of you can answer, is can you share a bit about how you intersect gerontology or center aging priorities in non-aging professional spaces? How do we get people to care more?
Wow. Could you just start it out with it like maybe an easier question? Karon, you want to start that one, or you want me to?
I'm gonna take a stab. So I think I can do this. Okay, so Trust for America's Health is not an aging or gerontology based organization. We are a public health advocacy nonprofit. So healthy aging is relatively new to Trust for America's Health. It's been a part of the organization for about 5 years. And prior to that, TFAH has focused primarily on disseminating, doing government relations, advocacy around public health, and doing various reports. So we just finished a report called Ready or Not every year. And that's actually the first report, if I'm remembering correctly, that we started working on. Is a report that talks about readiness for emergency preparedness. But the former CEO, the recent past former CEO, had a relationship with Terry Fulmer at the John A. Hartford Foundation, and they had a conversation about age-friendly public health, and that's how this came to be. So a couple of things. I think it's a situation of you have to have a champion at the table, someone that at least is, and then that doesn't have to be necessarily a gerontologist. It could be somebody that's just aware of the critical issues around older adults and aging. And it could be something like, I mean, I would say, and honestly, in my opinion, the pandemic has fueled a lot of interest in older adult efforts and healthy aging efforts. So I would say we can leverage what has happened, what we've learned over the past now almost 3 years, actually officially 3 years, and say, this is what we saw. We saw that we need to address social isolation. We saw that we need to focus on emergency preparedness in older adults in institutions and in the community. We saw all these different things related to older adults. So it mainly takes a champion to be at the table, but also I know data talks and data speaks. And so when we work with departments of health, speaking to this very core question, for a lot of them, they have the data. They take their data and they're saying, 40% of our county is over the age of 65 and we have nothing in place to support them. What are we going to do? So in that case, for many of the departments of health that we work with, that is what is compelling for their leadership and for people to really change and pivot their focus, because they realize, well, 40%, that's not two people. So we need to obviously think about and figure out what we're going to do. So I would say data and leveraging what we've learned through COVID. And again, you have to have a champion at the table that, again, helps if it's a gerontologist, because they can help, or someone with a strong background in understanding older adult issues, but it helps bring in and usher in that topic.
And I would just say good aging policy is probably good policy for everyone. And so whether it be universal design or health across the life course, whatever is good for older people is probably going to be good across the life, the life course. And that would be my philosophy.
Great. Any last comments on this one, or should I move on to the next question? Next one, okay. This one is for Karon. For students who want to go a non-academic route, what advice do you have for them to find different opportunities?
Oh boy. You have to be open and flexible to your settings. So I know, and I often talk about how my goal was to go to, well, I won't name the organization. My goal was to go to one organization very specifically, and I actually have never worked there officially, but there are opportunities outside of the traditional aging organizations. Now, if your goal is still to go there, that's one thing, and you can use different opportunities to get to that organization so you can get skills again along the way, but opportunities are everywhere. So again, I worked in affordable housing. That is obviously not, it was related, my project was related to older adults and older adult health, but that's not an aging organization. But there was a need to support the programming and partnership development in older adult housing communities across the DC, Maryland, Virginia area. So that was an opportunity not only for me to develop skills with community engagement, community partnership development, and implementation of interventions, but also, again, just getting some work experience on my resume. I will share a couple other quick tips. You have to have both a resume and a CV. I actually was critiqued once about having a CV submitted for a job opportunity, and the person told me, this is too long, you should never submit this. And I was like, but it's my life, it's my work. I want to show what I've done. They're like, we don't care. We want to know what's important, and we want to know what's important in a 2 to 3 page document max. We do not want this massive CV. I also did quite a few internships. I was in grad school, and I did I did a fellowship, I did a postdoc, which I did not know I was going to do. That postdoc just actually was the perfect postdoc for me. And I did a policy fellowship that brought me here. So I would say one of the key things that you have to make sure you're keenly aware of and you have to navigate is making sure that you have work skills that translate. So when I've helped people with turning their CVs into resumes, and a lot of times they'll write research assistant, dates, and place. I'm like, you have to list out what you've done. They want to see outcomes, whether it be you worked on 3 papers and they got them published. Put that down versus just saying where you worked. But also, again, making sure that if there's an opportunity to actually do something like a fellowship that is related, shameless plug for the Health and Aging Policy Fellows. That was a great experience for me in terms of just getting different opportunities and building my network, but also and internships are great. There are a lot of paid internships. I know GSA has one. A lot of the different various organizations they have policy related or even just aging related fellowships as well that'll give you, again, tangible skills that you can list out, as opposed to just saying, I did this and I was a research assistant. And then finally, I'll go back to my original point, leverage your network. So again, making sure that you're connecting at GSA and any other professional meeting you go to, and making sure you're really connecting. Make sure you keep connecting, even if it's just at GSA, make sure you grab 10, 15 minutes of that person's time. Try to even grab more time than that. But you never know what opportunities may develop. There was an opportunity once that developed at GSA because of a relationship that I'd had for several years, didn't think anything of it. And they were offering me a job at GSA. I was like, wait a minute, how did this happen? It's like, again, all I did was make sure I stayed in contact with that person throughout my trajectory. So again, leverage your network. You never know when opportunities are going to arise. And stay in contact with your peers as well. You never know where they may end up, and they may say, hey, we're hiring. I know that you'd be perfect for this. So if I had to sum it up, leverage your network, make sure you have a resume and a CV that are action-oriented documents, and then try to get any fellowship, or it doesn't necessarily have to be a postdoc, but in my case, the postdoc was very, very helpful for me. Any fellowship or internships you can get, those are always very helpful, again, because it's still part of that network building piece.
And the only thing I would add to that is that nothing's forever. And so, when I finished my PhD, I was so done with universities. I was like, I'm never going back to a university, and spent 5 years as working in the research consulting business. And after 5 years, I was like, maybe university isn't as bad as I thought. And I've been here now 38 years. So I think you don't have to think about your next move as your last move, because there's a lot of places to go over time, and people change. And so be open to exploration would be my advice.
I wholly agree with Bob. You can't, you don't have to have one job for the rest of your life. You can take on lots of different opportunities, and again, you might get tools and skills that'll help you get to that dream job that you have been eyeing.
That's great. We just have one last question, and then we're going to do some wrap up and closing remarks. So if you guys could answer this one quickly as you can. This last question is how to cultivate relationships within state government if you've relocated to a new state and want to influence policy.
I'll go ahead and start that. It's a little bit hard to remember at this point. We do so much work with state government, with both the Ohio Department of Aging, the Ohio Department of Medicaid. My first link in Ohio was that when we were evaluating the National Challenge Demonstration, I met somebody at the state and just spent time talking about home care, and then wrote my first proposal with the state to develop a quality improvement plan for their new home care program. This was in 1987. And we've had an ongoing relationship with the state now, and it's just kind of part of second nature. I would say for us, the reason why I think we're successful with the state is because we get that our work has to be applied and it has to help them do what they do. And I think sometimes the academic researchers are not focused on how their research is going to impact the lives of people. And I think that's something that we've done really well at Scripps. And so we do so much work with state agencies, but they rely on us as their R&D unit. And so I would say being able to forge a relationship and help state people to succeed in their job is a way for you to have a successful partnership with state agencies.
Great. Anything to add, Karon?
I was gonna say, try to figure out where they're attending, what conferences they're attending. So for example, I just attended the American Society on Aging conference. There were some state level representatives there. Again, attend their presentations and talk to them after those different talks. And to Bob's point, be an innovative partner. So academics, I'm assuming this person is in an academic setting, but academics can offer a different lens and a different level of engagement with state partners. So for example, one of the things that we've been engaged with is helping departments of health develop data profiles. And it turns out that the best partner to help them do that are typically universities. So the university has access to the data and expertise and the bandwidth. I would say the bandwidth for departments of health is not always a lot. They're usually not able to do as much as they would love to do, but offering to support them in some kind of way, whether it be a data analysis piece, which you all are, co-sponsoring and can work together on and publish and do lots of things with, is a great relationship and a great match, if you will.
That's a really good idea. I wouldn't have thought of that. I love that. Thank you again to Karon and Bob. Thank you so much for your time. This has been a really fascinating hour that we've gotten to spend with you, and I'm going to turn it over to Deborah, who's going to give our closing remarks and some reminders.
Yes, thank you everyone for attending. We will work to have a summer. We're trying to do quarterly social events and different events for SRPP. So we'll be on the lookout for the next event is in the planning stages and some announcements. Registration is open now for our 2023 GSA annual scientific meeting. Caroline Adams, who is our staff liaison for SRPP, just put the link for registration in the chat if you need it. I'm sure you all know exactly how to register and hopefully get the early bird registration. Also, award nomination deadline has been extended to April 6th. It was going to be April 2nd. So check out that link and the awards that are available and self-nominate for awards or nominate your colleagues. Election nominations for SRPP officers due April 11th. And that's another, reach out to any of the leadership if you're interested in being an officer in SRPP. We have our SRPP Health Science podcast series, The Crisis in Long-Term Care. We are still, it's in production stages, final production stages for the first episode, Who's Not in the House. And then episode 2 and 3 are published. And so check out that link. And thank you, everyone. I think we're right on time, just a minute to spare. Have a good weekend and have a great rest of the semester if you're in academics. And what else is coming up? Easter's coming up or other religious holidays coming up or in the process. Thank you, everyone.
Thanks, everybody. Take care.
Thank you. Have a good one.